Hello, this is Shawn Dolley. I'm Cloudera's industry leader for health and life science. And today I'd like to talk about how Cloudera has helped health plans leverage big data. So Cloudera is widely seen as the largest company that's focused exclusively on providing big data technology. And over 80 organizations worldwide subscribe to Cloudera's support and software distributions for open source big data technology. We're excited, and I'm excited about the customer base. The majority of lives in the US are covered by organizations that use Cloudera, and we have health plans on 4 continents and an absolute wide variety of use cases in use at these health plans. So it's been an absolute pleasure, and I thank all the health plan customers that we have for using our technology to help improve human health. One of the most frequent questions that we receive is about what use cases are most common in our health plan community. And I'd like to go through what those are. I've put on the slide a list of use cases that we commonly see, and they're ranked to some degree by frequency that we see them. And there's a legend included. You can see the colors. If you see color well, the red are ones that are leveraging the capabilities in big data for accommodating a variety and breadth of data types. The green use cases are focused on velocity and speed of throughput in data. And finally, the dark blue use cases are ones that focus on volume capabilities and scalability around storage and compute. So let's start. The most common use case, and the most common use case to start with, is complementing a health plan's enterprise data warehouse. As someone who used to be involved in helping health plans invest in enterprise data warehouses, I can tell you that these systems, as you probably know, are mature, sophisticated, absolutely mission critical. Our CTO at Cloudera and co-founder often says, not all of your data needs to fly first class. Well, in this case, Cloudera provides a coach class accommodation, if you will, for data that may be in your enterprise data warehouse, but doesn't need to fly first class. And by moving some workload or some data to Cloudera, health plans have been able to make those data warehouses faster, leaner, more well-served, and at the same time allowing them to invest in the leading edge products and solutions from those enterprise data warehouse vendors or partners. So that's a great cost benefit for health plans, as Cloudera is the arguably the lowest cost per active terabyte currently available. The second most common use case is one that is really driven more out of variety, and that is the ongoing effort to look at the population of members or cohorts of the population and understand outcome analytics, population health, comparative effectiveness in drugs, and really understand what are we going to drive the most benefit from within our portfolio of medical investments, what is going to drive the best health of our members, what should we put on our formularies, and this is a wonderful use case that we can, Cloudera can help a health plan bring more data, a wider variety of data to help, especially in leading edge areas of outcomes where we're looking at different kinds of data than we've ever looked at before. The third one is around payment integrity, or as a layman might consider fraud, and both numbers 3 and 4 have to do with fraud. The first one, number 3, is a real-time use case, and that is, can we pre-adjudication, as claims are streaming, apply metrics or insights and not pay claims that are clearly not valid. And the next one, the special investigations data mashup, is also quite common, and this is for post-adjudication payment integrity when there's a hunger for a wide variety of data sources that can help us understand who is abusing the system. And on that use case, we have some, of course, wonderful stories. The fifth one is both, as you see if you're looking at the color coding, both a velocity use case when it comes to patient stratification, as well as maybe a more variety around understanding care coordination in a patient-centered medical home. So in patient stratification, whether this comes out of at a patient level doing geographic-based hotspotting, whether it comes from more of a precision public health approach or looking at populations to drive better care coordination and more focused investment, the idea here is that I am more quickly and in a more educated way going to be able to assign my members to levels of needed care. And it's wonderful efforts that are going on today, and Cloudera aspires to make those better and faster. Number 6 that you see, a little less frequent, but oftentimes, and we acknowledge and have a wonderful partnership with SAS, that while languages like R are coming along well in providing abilities to do statistical analysis and advanced analytics, that SAS really is ubiquitous. It's very strong in this segment of healthcare, and mature SAS environments often have adopted and ingested and created and support a number of workloads that are really not sort of first-class travel kind of workloads, and some health plans have been able to move some compute and processing away from SAS into something like Cloudera. This enables them to use their already fast SAS analytics and make them even faster, and allow them to save money and then invest in the SAS solutions that are really leading edge. And the last one is now at health plans I've seen just a wide collection and usage and just more availability of doctor's notes from clinical partners and other sources, and the desire to have those data scientists apply natural language processing to doctor's notes, find insights, and often add those insights into the structured data in an enterprise data warehouse. There is quite a long tail of other use cases that folks have used and will continue to innovate, and we're happy, of course, with that. But taken together, these are the most common use cases that we see for big data at a health plan. So with that, let me just say that we do believe, and I have seen every day, that folks that want to be HIPAA compliant and stand up big data, hardened environments that are super fast, easy to administer, very secure, have been very successful with Cloudera doing that, and I think most successful with Cloudera doing that, and I'm proud to be a part of it. Just a little bit about me. Feel free to send me an email if you have questions at sdolley@cloudera.com. And then, why am I doing this? And you can too. I'm doing it to make a difference in public health and human health, and I try to do that every day, and I'm happy that Cloudera gives a forum for me and for our customers to do that as well. So with that, thank you very much.